IP DRG coding, inpatient diagnosis related groups. See, IP DRG coding is one of the specialty in medical coding. So the full form for IP DRG coding is inpatient diagnosis related groups. So like we have a many specialities of coding. If you see like CC coding, and ENM coding, radiology coding, surgery coding. So this is one of the specialty coding, and it will be the payment is calculating based on the DRG value. So we'll see what do you mean by DRG and all in the next slides. So just remember, IP is nothing but inpatient, DRG is the diagnosis related groups. Shortcut, everyone is called that, IP DRG coding. Okay, if you see here, the Medicare inpatient prospective payment system, let me increase the size. Yeah, so if you see the introduction here, the Medicare inpatient prospective payment system, which is called IPPS. There are two types of payment systems. One is called IPPS, inpatient prospective payment system, and the other one is the you know OPPS, outpatient prospective payment system. Again, in that, physician fee schedule. So it will be a different types of payments. But keep in your mind, the Medicare, IP DRG coding is clearly mentioned. It is based on the inpatient prospective payment system only, and it is a Medicare. It's like, there will be a different types of payers, but this prospective payment system is IPPS, inpatient prospective payment system. It was introduced by the federal government in October 1983 as a way to change hospital behavior through financial incentives that encourage more efficient management of medical care. This was, IPDRG coding was introduced in the October 1983, and because, just example, if you see in India, if like a person is having any insurance, or the his or she is admitting in the hospital with a insurance, definitely they will try to claim more money from the insurance company. So might be the treatment also were maybe not efficient. For that all the reasons, this Medicare IPPS system was introduced by the federal government in October 1983 as a way to change hospital behavior. Behavior in terms of all, it might be a treatment, or how the doctor is behaving, or everything, this which includes everything only. So that would be a hospital, like in payment systems, and what are the treatments, are they giving correct treatment, or necessary treatment, or necessary treatment, that all will becomes under hospital behavior through a financial incentives that encourage more cost efficient management of medical care. So based on that IPPS in the United States, first thing first, this will be a helpful for the payer side as well as the physician side. Physicians, will get a incentives if they are providing a proper treatment, and they are giving necessary treatment and necessary test. Everything will be calculated, and every year they will get a incentives basis also. Now under IPPS, hospitals are paid under IPPS. So going forward, do not surprise what do you mean by IPPS. Okay, IPPS is a inpatient prospective payment system, and it is a one of the classification. The payment would be calculated on the under this system, inpatient prospective payment system. So hospitals are paid a predetermined rate for each Medicare admission, and each patient is classified into a diagnostic category, which is called MSDRG. It's nothing but Medicare Severity Diagnosis Related Group, on the basis of clinical information. Every patient, definitely the patients will admitting the hospital for some reasons, right? Let's take an example of the patient admitted in the hospital for a severe abdominal pain, so or like the leg fracture. The different scenarios the patients will admit in the hospital. So this first criteria, we should understand what would be the reason for admission. So based on that, we will add the primary diagnosis, or we can call it as a principal diagnosis. So each patient is classified into a diagnostic category, which is called MSDRG, on the basis of clinical information, except for certain patients with exceptional high cost called outliers, and the hospital is paid a flat rate for the MSDRG regardless of the actual services provided. So this all will be, I will be discussing in the, like the coming classes, what do you mean by outliers, what is the IPPS, the UB0 form, UB04 form looks like, right? What are the form includes? So that all I will be covering in the coming classes. Now let's see, what is IPDRG coding? What is IPDRG coding? IPDRG, the inpatient diagnosis related group coding, is a classification system used in healthcare to group patients with a similar diagnosis and procedures for billing and statistical purposes. This is the main reason. It's not only IPDRG coding, whatever if you take HCC or ENM or surgery, everything what we are coding is for the mainly billing purpose, and also that helps for statistical purposes. Statistical purpose. So it is a classification system used in a healthcare to group patients with a similar diagnosis and procedures. So what are the diagnosis and procedures? These diagnosis and procedures will have a DRG value. Some number, some weightage will given to that particular diseases, and so that is called diagnosis related group. So there will be a diseases diagnosis and procedures calculating, and they will give some value for that. So DRG value, we will not create anything, it is already which is developed by the CMS and the Center for Medicare and Medicare Services. Now IPDRG coding stands for, this is inpatient diagnosis related group coding. It assigns patients into groups based on their, see here, diagnosis, procedures, age, and other factors. Based on all these criteria, the DRG, the DRG payment will be paid based on this all these factors, and allowing healthcare providers to classify and bill for inpatient services. So I just want to clarify here, inpatient services, the patients are admitting in the hospital and, stays overnight stay, or it's more than 24 hours. That is called inpatient and IP coding, inpatient. And the IPDRG coding system organizes patients into distinct groups, each with its own payment weight assigned by the CMS. See here, everything is developed by the CMS, and the weight, which is DRG weight, determines the reimbursement. So finally, so based on the DRG weight only, the hospital will get the payment, and which is called reimbursement amount. A healthcare facility is just like it's a hospital center, will receive for treating a patient within a specific IPDRG group. The simple answer how the hospital facility will get the payments based on the weight, and the weight, DRG weight, determines the reimbursement amount a healthcare facility will receive for what the treating, the what are the treatment they given to the patient, and what are the resources the patient has been utilized in the facility, which is hospital. So everything will be calculated, and based on that the DRG weight will be there and will be provided the payment. And next, what are the different types of DRG? If you see here, these are the different types. And if you see what we just discussed, right, MSDRG, that's also called CMSDRG. So Medicare diagnosis related group, refined DRGs, the shortcut is RDRG. All patient DRGs, which is called APDRG. Severity DRGs, SDRG. All patient severity adjusted DRGs, APSDRG. All patient refined DRGs, which is APRDRG. International refined DRGs, which is IRDRG. So right away, all patients are just, it's all the payers. So whatever the type of DRG, but all the coding guidelines are similar, and only the weightage would be the different. But every coding guideline, what are the IP coding guidelines, will be applicable for this this DRG, which is medical DRG, refined DRG, all patient DRGs, severity DRGs. For all the DRGs, coding similar, and we just the weights only different only. The next, what is the purpose of DRG coding? What's the purpose of DRG coding? Let's see here. Allow reimbursement based on severity of illness. Allow reimbursement based on severity of illness. And so allow reimbursement based on severity of illness means, if you see, like some patients may admit for the diseases, the diagnosis, or it has been classified into some major severity, like just severity and not severity, like we will call in DRG coding as major condition comorbidity, which is called MCC. And other one is called CC, comorbidity condition, and other one is non CC and non MCC. Out of all these three categories, if a diagnosis is having CC, that would be having a higher payment. And if a diagnosis is having, let me give you an example. There are 5 diagnoses, and out of 5 diagnoses, the one condition is having MCC. That's a very severity only. So that we should code it as a primary. Of course, the payment, like that is what based on severity of illness only. Severity of illness. Let's take acute respiratory failure. Right, acute respiratory failure is a severity, right? And whereas if you take just abdominal pain, compared to acute respiratory failure and abdominal pain, I'm telling you 2 patient scenarios. One patient admitted with acute respiratory failure, and other patient was admitted with the abdominal pain. Of course, the patients will also have other comorbid conditions, which is called the other existing coexisting conditions, and like hypertension or diabetes. But irrespective of other diagnosis, but our IPDRG coding only looks what's the reason for admission and what doctor did for that. That's what based on severity of illness, what treatment the doctor has given to that patient. This all will be calculated, and so based on that only, they will get the proper reimbursement. The next one, evaluate effective utilization of resources. So not only treating of the not only they will look into the treatment, but what are the resources utilized to the patient, like bed charges, everything will be included, and like a nurse room, all based on all this, the DRG will be calculated. The DRG will be calculated. Next, the third point, if you see there, improve quality of care. So definitely this will be improving every facility, they will improve the quality of care, like definitely based on, if they are not giving proper treatment, definitely the DRG value will go down, then they loses the money, right? So by ultimately every hospital will give the proper treatment only. So that's called improve quality of care. And the last one, if you see, increase transparency in hospitals billing. There is no fraud. They will be very clear This is bill, this is what the test done, and this is the treatment, and these are the days the patient in the hospital. Everything will be transparency, but that is not happen in India. This much transparency is not in India. Just imagine, okay, right? So that is what all the purpose of DRG coding. These are all the purpose of DRG coding. Now, the next point, if you see here, how is DRG calculated? Each hospital also has blended base rate, which is based on variety of factors. So just we discussed, right, the location, patient demographics, and DRGs are based on the patient's principal diagnosis. Principal diagnosis, which is that is the primary reason they are admitted to the hospital. Though the patient is having multiple conditions, but what's the reason for admission to the hospital will be the you know, should review carefully, and what is the purpose of admission and what doctor did for that. You know, the principal diagnosis meaning is the condition established after study. The condition established after study to be chiefly responsible for the patient, you know, to be chiefly responsible for the patient to the, you know, admit in the hospital, right? So the doctor will do evaluate and he will confirm the diagnosis. That is called the condition established after study. Simple. And the principal diagnosis meaning, of course, I will again cover this topic, but I just want you people to understand principal diagnosis is the condition established after study to be chiefly responsible for admission of the patient to the hospital for care. Example I'm telling you here, the patient admitted in the hospital for severe abdominal pain, and he's also having hypertension, diabetes, and asthma. But I will not look into asthma, hypertension, and diabetes because the reason for admission is the severe abdominal pain. Now, what doctor will do? He will study in the terms of, you know, they order some tests and like, you know, it maybe CT scan or some other related tests they will do. After the test, you know, the doctor will confirm that this is an appendicitis. This is called, you know, appendicitis is the condition established when after study. And what he studied, because the patient admitted in the hospital for severe abdominal pain, right? That's a doctor like responsibility to what's the cause of that severe abdominal pain. So that is what exactly principal diagnosis. And sometimes the patients may admit for more than two to three conditions also. That all we will be covering in upcoming classes. But just keep in your mind that would be the very important in IPDRG coding. Not only IPD, like, you know, any coding, but IPDRG coding is based on this principal diagnosis only. The payment will be effective only. And also any surgical procedures and any comorbidities that complicate the treatment or add to the resources need to care for the patient. Now the doctor has been identified that's an appendicitis. Now what the doctor is planning to do, he wants to do a appendectomy, not immediately, but tomorrow. Still the patient is in the hospital itself. Now appendectomy is done. So for that also we will code the procedure code. And remember, in medical coding, we have a books, right, which is called ICD-10 CM, and this other one is, if you see, a CPT, and ICD-10 PCS. The PCS only we will be using in a DRG coding, inpatient coding, IPDRG coding. CPT will not work here. IPDRG coding is purely we will use only ICD-10 CM book and ICD-10 PCS book. That's correct. So these two books only we will be using. And ICD-10 CM is for diagnosis coding and ICD-10 PCS is procedure coding. And also see here, any comorbidities that complicate the treatment or add to the resources needed to care for the patient. So in my example, the patient is also having diabetes, hypertension, and asthma. Definitely that will be considered as a comorbidities, and I will add that into the report. Now finally, the discharge disposition. If generally it is a routine, if they will discharge to home, that would be considered as a routine only. In case if the patient is transferred to some other facility, that also will affect the DRG. Or if the patient expired, that also will affect the DRG. So these are all the elements, or we can call it as a factors, which includes the DRG calculation, which includes the DRG calculation. So the relative weight of the DRG is multiplied by the hospital's base rate to determine how much the hospital will be paid for that patient. So every hospital will have, there is a base rate only. So the calculation part, in the coming classes, one day I will explain how it will be calculated. But just write in your mind, the relative weight of the DRG is multiplied by the each and every hospital base rate. So for example, if you take Apollo Hospital is having one base rate, Yashoda Hospital is having one base rate. So that's it. Based on hospital, their base rate will be different only. So based on that also, the payment will be different. But the relative weight is same for every, like, the conditions, based on the conditions. That will be multiplied with the hospital base rate. So that determine how much the hospital will be paid for that patient from the insurance company. Now let me show you some examples, like how the DRGs, if you see here, on the left side, you have, see, right, MSDRG. So this is about, Medicare severity diagnosis related group, which you can see 470, which is description is a major joint replacement or reattachment of lower extremity without MCC. And if you uh, uh, just follow this, but I'll cover this again. 885, the MSDRG value is 885, which is psychosis, all psychiatric conditions. And 871 is septicemia without MV 96 plus hours with MCC, and 945 rehabilitation with CC or MCC, and 392 esophagitis, gastrointestinal and misdigestive disorders without MCC, and 194 if you see simple pneumonia and pleurisy with CC, and 291 heart failure and shock with MCC, heart failure and shock with CC, kidney and urinary tract infections without MCC, nutritional and miscellaneous metabolic disorders without MCC only. So, like the DRG, if you see, 470 is all related to the joint replacements only, and 871 is the septicemia related. Rehabilitation is a 945. These are just examples. So based on this MSDRG value will give some weightage, and along with like that weightage will be calculating with the every hospital base rate will give the final payment to the hospital. Final payment to the hospital. All right. So let me show you some different scenarios, and what is ICD-10 CM, and ICD-10 PCS looks like, and what is CC, MCC. Because if you try to understand here, each and every DRG value is having, like most of them are having without MCC, with MCC, and here if you see rehabilitation with CC or MCC, right? And if you see here with CC, with MCC, with CC, without MCC, without MCC. So the concept of IPDRG, we have a ICD-10 CM, right? In ICD-10 CM, there are thousands of codes, but not all the thousand of codes are having MCC values. MCC is the major complication comorbidity. I'm repeating, MCC, major complication comorbidity. CC, complication comorbidity. The next one, let me give you an example, Andy. For example, a patient is having appendicitis and hypertension and shortness of breath. Three are there. Now, if you see appendicitis having MCC, these all will be, you can see in the book. And right away, the companies for IPDRG coding, they are using a 3M software. In the 3M software, if you enter the condition appendicitis, it will give whether it is MCC or CCR. Or else, just a moment, I will show you how the conditions are classified. Just give me a moment. Okay, fine. This is just, 3M, like, we have a coding software, but I just want, this is a Encoder Pro. I just want to show you like how the diagnoses are having, for example, let me take E11 point, or else E11.65. Okay, so if you see E11.65, which is a type 2 diabetes mellitus with a hyperglycemia, right? Now it will show whether it is MCC or CC. Let me show you. It is not having any value, either MCC or CC. Let me check another code. Right, can you see here what is U07.1?
Yes, MCC.
COVID-19.
It
Yes,
is MCC.
COVID-19. Exactly. It is clearly stating that MCC. So if a person is having, multiple conditions, see here, it's clearly mentioned there, the description also. MCC is a major complication. That's a comorbidity only. Okay, and clearly mentioned that is inpatient only. So for inpatient only, we will calculate all these MCCs, CCs like that. Okay, and even if you see, let me check this one, U07.0. I don't think so. This is not having a CC or MCC. This is falling under non-CC and non-MCC only. Non-CC, non-MCC. Okay, let me try another code. Okay, I'm going back to U07.1 and I'm seeing the complications over there. Okay, let's check pneumonia due to COVID-19, right? Let me click on J12.82. Now J12.82, it is also MCC, major
MCC.
complication, comorbidity. So this way, what we do know, we will review the documentation of all the conditions, but the first thing is whatever the reason for admission, that we will be the primary diagnosis only. That may be a MCC or CC or non-MCC, non-CC, but the next, what are the other conditions we have to look into, which is having CC, that would be to the next. So simple, the scenario, like a hierarchy is the first MCC, the next CC, the next non-CC or non-MCC. So like that way, we need to add the diagnosis codes. So for this way, we can check MCC, CC conditions like that. So these are all the MCCs only. But however, if you like checking in the next coming classes, definitely I'll show you the CC conditions also.